You are listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. You can also find AAPCHO on Facebook. Hepatitis B is the world's most serious common liver infection transmitted through infected blood, unprotected sex, illicit drug use, and from an infected woman to her newborn. Ted Fang is the director of the San Francisco-based AsianWeek Foundation, a nonprofit committed to developing the voices of Asian America. Today, Ted speaks to AAPCHO's Director of Communications, Stacy Lavilla, about the AsianWeek Foundation's work in hepatitis, specifically its work with the San Francisco HepBFree campaign, which is a citywide campaign that provides free and low-cost hepatitis B testing and vaccinations to Asian and Pacific Islander adults in San Francisco.
So Ted, thank you for joining us today. I was wondering if you could tell me a little bit about the San Francisco Hepatitis B Free campaign.
Yeah, I'm glad that you guys are doing these podcasts because I think it's so important to put out the word about hepatitis B. This is the greatest health disparity, the greatest health challenge for Asian Americans and Pacific Islanders, and yet there are prevention methods and treatment methods that we can make this issue go away. We can actually eradicate hepatitis B as long as we get the community involved. When that happens, when we are able to eradicate hepatitis B, there will be a book written about how it happened, and that book will document that it started in the Asian American community. I think the hepatitis B movement is an important turning point for the Asian American community.
Okay, so what are the primary goals of the campaign?
The goals are to change practice patterns of primary care physicians so that this can be dealt with in the doctor's office. Our goal is to affect a policy and legislation that can make sure that people who have hepatitis B disease can get treatment and don't have any insurance problems. But with all those policy and education changes that we are looking for, it all comes from mobilizing the community. The success that we have had with the SF Hep B Free campaign stems from the fact that the Asian community has come together around this issue. We have over 150 local community Asian, Pacific Islander, and healthcare groups that are supporting this initiative. So we take that community support and we go to the hospitals, we go to the physician groups, we go to public officials, and let them know how important this issue is to the community. And through that community involvement, we are able to get virtually every hospital in San Francisco now has some elements of a hepatitis B campaign. And we are working with many physician groups as well about educating around hepatitis B. And we do a lot of community education. Unfortunately, it is very difficult these days to get primary care physicians to change their practice patterns because of the limited number of primary care providers and because of their great burden that's put on them for all the medical needs. So one of the tactics that we do use is by educating the community to educate the physicians. So we are really, in that sense, trying to empower the community.
I know that the SF Hep B Free campaign is really unique in that it's built on unique partnerships between the public and private sectors. So I was wondering if you could speak a little bit about that and how it is that AsianWeek Foundation got involved.
The AsianWeek Foundation is about developing the Asian American community. And hepatitis B is one of the best issues in which to help develop the Asian American community, and an issue that we can organize around, an issue that is solvable. And so one of the things that we have been able to bring to the Hep B Free campaign is really cultural competency as far as organizing the Asian American community. I think it is true that there are not very good large-scale examples of organizing the Asian American community. So one of our challenges was, how do you organize the Asian American community? And we have unique characteristics. For example, when the gay community was confronted with HIV, protesting, acting up was more appropriate for that community. Those tactics aren't appropriate for the Asian American community. As a matter of fact, when we started the Hep B campaign, we did not start with any kind of demonstrations or anything like that. We started by holding a huge community dinner because all Asians understand that. But in that community dinner where we had over 500 people attending and 100 different groups represented, we made sure to not just bring the community, but to bring the public officials as well, and to bring the corporate business heads as well. And so the elected officials, for example, Mayor Newsom was there responding to the community and said publicly at that time that he wanted San Francisco to be a model for fighting hepatitis B. Because we also had the business leaders there, the hospital CEOs there, they were able to hear the mayor's priorities, and that helped to bring them on board. So this is how we've been able to leverage community and bring all parts of the society into this effort. The main characteristic of the SF Hep B Free campaign is that we are multifaceted. We work with nonprofit groups, we work with community groups, we work with healthcare groups, we work with elected officials, we work with businesses, we work with pharmaceuticals, we work with everybody. And it's been personally extremely rewarding to me to see how the Asian American community has come together around this issue. We are proving that Asian Americans are a powerful organizing force.
This podcast was brought to you by AAPCHO with generous support and guidance from its Technical Innovation Advisory Committee members, who share AAPCHO's vision of equitable, affordable, and culturally and linguistically appropriate health care for all. Please visit our website at www.apcho.org to reach us with your comments and questions.